to call this special meeting of the legislature to order. You could please stand for the Pledge of Allegiance.
To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Roll call of members. Deborah Dawson. Here. Henry Granison.
Present.
Rich John.
Here.
Dan Klein is asked to be excused. Ann Corman. Here. Mike Lane.
Here.
Leslie McBean Claiborne will be arriving later. Dave McKenna. Glenn Morey.
Here.
Martha Robertson. Leslie Show. Mike Sigler.
Here.
Shauna Black. Here. We have 8 members present. Thank you, Kathy. We do not have public comment on our agenda. However, we do have a guest of the public here today, and I would like to entertain his comment. I just want to go over the rules for speaking under privilege of the floor. I also see we have another guest that's joining us today. If you would like to speak under privilege of the floor, please make sure to fill out one of the blue forms. The rules for speaking under the privilege of the floor. Number 1, I agree to a 3-minute time limit. Number 2, I agree not to raise my voice. Number 2. Number 3, I agree not to use lewd, obscene, profane, slanderous, or libelous language, or speak or act in a manner that would tend to incite a breach of the peace. Number 4, I agree not to speak about county personnel matters. Personnel matters include comments about the job performance of employees other than elected officials. Number 5, after 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. I agree that if I cause a disruption and am asked to leave, I will leave the chambers. And the first person that we have is Zach Wynn. Mr. Wynn, you have 3 minutes.
Thank you. I'd like to speak out against this proposed vaccine mandate for county employees. I believe it sets a dangerous precedent, and a person's decision to take a vaccine or not should be their own. And there are any number of legitimate reasons for someone to not want to take this vaccine. Some as simple as having had COVID in the past, and vaccinating when you already have antibodies can exacerbate the known dangers from this experimental vaccine and its known side effects. And the impetus for this entire effort to mandate vaccinations for county employees was due to Governor Cuomo, hopefully our former governor. So I think it might be wise to just table the entire suggestion until at least we have a new governor and see if she thinks it's a good idea. That's basically all I have to say. So thank you very much.
Thank you for coming to public comment this afternoon. I have no other blue cards. I've seen no other hands. Let's move on to our business. We have a resolution to talk about this afternoon. Resolution A, implementing New York State Governor's recommendations that all county employees be vaccinated against COVID-19 or get tested weekly, ID 10296. And I would ask that everyone look at the resolution that has been put on your desk. This is an edited version that came out of budget. Can I have a mover for that? Moved by Deborah, seconded by Martha. And let's start conversation. Actually, can we have Lisa or Amy talk a little bit about this resolution first?
Okay, I can start by saying this resolution was provided to 2 different committees at this point. We were asked to create this resolution because really the idea that COVID vaccines are safe and effective at preventing the COVID-19 disease, and especially severe illness and death while reducing the spread. We are following the guidance that New York State has set up and mirrored our program to look similar to the state program. And one of the components to that is really looking at that population immunity and working to reduce really the dangers of this spread. So this is something that we are proposing to do and mandate starting October 1st. That would provide time for employees to go ahead and get tested and become fully vaccinated. If an employee chooses not to get vaccinated, it would then be tested on an ongoing basis. As a result of the first committee discussion, we discussed that the public health department will help determine what that ongoing basis looks like based on disease surveillance. So that's the bulk of the resolution. The surveillance testing program would allow us to monitor what the spread looks like among our employees. And the entire goal is to prevent really that public exposure and reduce what's happening with the COVID.
Thank you, Amy. We also have Dr. William Claypeck, who is our Tompkins County Medical Director. Hello, Dr. Claypeck. Thank you for joining us. I see that he is pulling over right now.
Now he's frozen.
She's trying to figure out how to.
Dr. Claypeck, why don't we come back to you in a few minutes? Well, I'm guessing he might try and rejoin us. We also have Ruby Pulliam. Oh, Dr. Claypeck, are you back with us? I feel like I'm a CNN correspondent. Dr. Claypeck, I think you're on mute.
And it's frozen.
And you might be frozen. Okay, let's go to Ruby and see what the implications are from a human resources standpoint. See if you can talk to us a little bit about this.
Okay, hi, I'm really here just in support of the resolution from the County Administrator's Office. We've talked about the implications for human resources in the matter of labor relations. We were advised by our legal attorneys that if we were mandating it, then we should be prepared to pay for the testing costs. Other than that, we would need to make sure that we had the information on file and that employees could share that information with HR so we can determine the numbers of vaccinated versus unvaccinated and where the unvaccinated were. Pretty much as long as those things are taken care of, we're good from an HR perspective.
Thank you, Ruby. Dr. Claypeck, welcome to our meeting.
Thank you. Good afternoon.
Good afternoon. Would you mind talking to us a little bit about the importance of the resolution that we're voting on and what your opinion is?
Yes, I think the importance of it is lies in the protection of vaccination for people to avoid becoming infected. It's very easy to confuse a couple of very important points. Number one point is that if you're vaccinated, it's extremely unlikely for you to get infected. Extremely unlikely. And if you, by chance, did become infected, likewise, it's extremely unlikely for you to become seriously ill. What people can run the risk of confusing is this new appreciation that due to the Delta variant, if you become infected as a vaccinated person, you can be contagious. We know that from some recent studies, some recent data that's coming in. Other studies are ongoing in order to clarify that situation further. But I think it's extremely easy for people to confuse those 2 points, and by doing so, come to the conclusion that vaccination is not effective. On the contrary, vaccination's primary mission is several-fold. One primary mission is to avoid people becoming seriously ill and dying, to avoid them becoming affected in the long term by post-infection consequences. And we know that the current vaccines, even with the Delta variant, are avoiding people becoming seriously ill and dying, being hospitalized. What we do know also is that it's extremely unlikely for them to become infected in the first place. But if they do become infected, it is possible to be contagious to other people. By increasing our vaccination rate in the region and in our county, we can further curtail the spread. That is the
Dr. Claypack,
major mechanism by which we.
what might be helpful, if you can turn your video off, I think that will help the connection so that we can hear you better.
I'm sorry, I didn't quite hear you. Shauna, can you repeat that?
Yes, can you turn your video off? I think that will help with your connection issues. And we'll be able to hear you better.
What would you like me to do?
Turn your video off on the Zoom.
Okay,
Yes, I think that will help with your connection issues.
very good. Where should I go back to, Shauna?
You want to just continue where you were?
Sure. I was talking about stopping the pandemic, and I was talking about that even with the Delta variant, that vaccination remains our key mechanism for stopping the pandemic, along with using secondary measures when the circumstances warrant, such as we know, masking and distancing and disinfection, all the other things that are important. Those known measures are still effective against the Delta. And I would reiterate one other point. The Delta we know is far more contagious than the United Kingdom variant, and even more contagious than the original viruses that we were dealing with at the very beginning of the pandemic. However, in other respects, the Delta is the same virus. We know it's spread by respiratory means. We know how it's spread. We know that although some cases may be acquired from surfaces, that the airborne spread is the predominant mechanism. Those kinds of things are no different for Delta than for the other coronaviruses. But unfortunately, we do know that it is more contagious, and that's why we have seen this uptick in cases. From our information that we have at the health department, we know that the Delta variant is 84% of what we are currently seeing, maybe even bridging up into the 90% range. We know that from local data that we've accumulated at the department. We also know that most of these cases are coming from people coming together in groups without adequate measures being taken. And we know that that if we use appropriate measures, we stop the spread. We know that when we institute contact tracing, we get right on the job and follow up these positive cases, that we succeed in our public health mission of stopping the spread. By getting more people vaccinated, we'll have an even greater success, and we'll see far fewer cases, and we will also be contributing to stopping the pandemic. Thank you. I'm certainly open to questions anytime.
Thank you, Dr. Claypack. Okay, I'm going to open the floor up for legislators. Are there any questions or comments? We have Martha and then Annie.
I want to thank Dr. Claypack and thank the health department for all of the department's work last 16, 18 months on all of this. And I just went to the health department website, looking for information on the vaccines. For example, questions you asked us, there are questions here with answers from the community. Will the vaccine affect my fertility? There's no evidence of that. What's the difference between the vaccines? The vaccine was developed too fast. All sorts of comments that we hear on Facebook pages or on social media or in conversation about reasons not to get the vaccine are addressed on the Tompkins County Health Department website. So I'm not going to go through them all here, but I've been so proud of the health department this year and everybody, all the other staff who have supported the health department in being leaders on following the science and promoting the vaccine, making it as accessible as possible, going to bus stops, going to farm workers' sites, going to all sorts of community centers with vaccines, taking vaccines to physicians so they can give them to their patients, because it is the way out of this pandemic. Of course, a vaccine doesn't help for 4 weeks until you're fully, immunized. So that's why we wear masks as well. But this is a critical step. And in my mind, Tompkins County's employees should have faith in their own peers, their own colleagues, their own health department, and should believe them when the health department says this is what the community needs to do. And I have no problem asking all of our employees to take this step and support the leadership of the health department, because that's what's made our community as safe as it has been through this whole pandemic. I feel strongly that this is not a matter of limiting somebody's personal freedom. These things affect other people. It's not your only choice that only affects you. It affects everybody around you. So we have a responsibility as part of the human community to take care of each other, and I have no problem expecting this of our employees. I appreciate Ruby saying that the law says we have to pay for testing. I was going to support paying for testing anyway, but I really, really want to encourage our employees to do the safest thing and the best thing and get vaccinated in any case. Thank you.
Thank you, Martha. Ann, Rich, Henry, and then Mike.
Thanks, John. I think you had asked if anybody had any questions for Dr. Claypack, so I'll stick on that for now.
Okay.
Not saying that there's not other things, of course, we want to talk about, but I'm just gonna, I might say something later, but I want to just ask Dr. Claypack, so some of the questions that I've seen the community raise and people have been asking me. So if the county, for instance, is, now that we're mandating our employees to wear masks, aren't we safe now? Like, do we still have to worry about vaccinations? And then the other thing for question that I've been getting is, well, if people are vaccinated, they don't have to worry, right? It's just the people that are unvaccinated. So I wanted to see if you could answer those questions a little bit.
Thank you. Certainly people who are vaccinated still would need to worry about being infected, although the odds are greatly in their favor. As you know from recent accounts, the most dramatic perhaps is the one in the state of Massachusetts over the 4th of July, when gatherings of people happened. Vaccinated people became symptomatic and tested positive. So it's not a carte blanche. Being vaccinated is not a carte blanche to say, oh, I don't need to take any precautions. One should, and one would be prudent in doing so when it's warranted. Masking certainly does help a great deal in terms of cutting down the spread of the disease, but it is not as powerful as vaccination in stopping the pandemic. And on a practical sense, I think we all know that we, in a workplace environment, for example, we would try to do our very best in using masks and using them appropriately, but sometimes slip-ups occur, and that can be an exposure for individuals. I would like to dovetail with something that Martha Robertson was bringing up just a moment ago in terms of confidence about the vaccinations and their development. Perhaps most all of you know that both the Pfizer vaccine and the Moderna vaccine have submitted and applications for full licensure. It's quite likely that by the beginning of September that Pfizer vaccine will be fully licensed. The Moderna vaccine will probably be a month or two or so after that point. And sooner or later, the Johnson & Johnson vaccine is expected to submit an application for licensure. These companies wouldn't be wasting their money and time submitting hundreds of thousands of pages of documentation that the FDA requires for full licensure if they weren't very confident that they would get it. And I think that should give the public, even before full licensure comes about, some added confidence that these are vaccines that meet the kinds of safety and efficacy standards that should give everybody comfort. Thank you.
Thank you very much. Next is Rich. John?
Yes, I supported the resolution at the committee level, and I intend to support it again today. I just had a couple comments. One is I'm registered as a Democrat. I'm very clearly not a fan of Donald Trump, and I said so. But at the same time, his administration in the development of this vaccine did something extraordinary. We mentioned in the resolution Alex Azar, who was leading Health and Human Services when in the development of the vaccine. This is a remarkable success story. And I understand people call it an experimental vaccine. Well, all vaccines can be called experimental because there's going to be a certain number of bad reactions to any vaccine. If you read the history of vaccination, some people don't react well. We've had more than 100 million people take this vaccine. The people who've had bad reactions to it is vanishingly small. And the benefit is very clear. If we compare our incredibly fortunate country with our vaccines to other countries like India that had awful experiences because they didn't have a vaccination program, we are in a remarkably good place from that standpoint. But we still have about 30% of our population who just won't get vaccinated and need some push to do it. I had expressed at the committee level that I find this infuriating. I still do. And I will share it with everybody. I got off the phone with my daughter to come here to this meeting when she's telling me she got tested today and she has COVID. And she seems to be doing okay. She's vaccinated. Her symptoms are pretty mild, but this is totally unnecessary. This didn't have to happen. We, as a country, if we were patriotic, we would have been at a much higher vaccination level. The Delta variant would not have gotten its foothold here, and we wouldn't be sitting here with masks on. This is really stupid. And I've just run out of patience. I don't have any qualms at all about voting for this resolution. This isn't a Band-Aid. This is, you get vaccinated, you don't have to be tested. If you still feel that you can't take this vaccine, then yeah, you got to do something for your coworkers and the community at large, which is get tested. I don't understand how that's an imposition at all. Anyway, I'll stop talking about it. It's just outrageous.
Rich, thank you for sharing your story. And I'm sure I speak for all of us that we hope your daughter feels better. And
Thank you. I'm sorry for getting angry.
No.
I am angry.
no, this is a personal story.
It's my daughter.
That's right. That's right. Thank you. Henry and then Mike.
Yes, Dr. Claypack, you talked about the unvaccinated people, but I noticed in the talk that you released last week that most of the people who tested positive had already been vaccinated. Can you basically talk to us about that for the last week in the chart? Can you talk about that a little bit?
Yeah, certainly, I'd be glad to, Henry. There's one dynamic that as we go forward and a greater and greater percentage of our population is vaccinated, then that would tend to also mean that any new cases that we see have a higher probability of being in vaccinated people, simply because more and more people are vaccinated, even though what is called breakthrough infection, that is to say, infection that occurs in a vaccinated person more than 2 weeks after their last dose of the vaccine, is, even though that breakthrough infection probability is very slim, something on the order of less than 1%, something more like 0.2%, perhaps. It's still, I say perhaps, but this number has been worked on by studies after studies, and we are very, very confident that it's significantly less than 1%. So the fact that we have seen upwards sometimes of 50% of our cases being in vaccinated people, to some degree reflects our very fortunate high vaccination rate in our county, even though it's not high enough to stop the pandemic. The other thing that's operative is that a great number of these cases have come from clusters of vaccinated people who in their midst had a contagious individual. They were in crowded situations such as being indoors, in bars, in public spaces, where upwards of 20, 30 of them, perhaps more, were gathered together. Who the index case was, who that first infected individual was that infected these vaccinated people, is hard to say. Was it an unvaccinated individual? Was it one of the vaccinated people maybe who had traveled someplace and picked up the infection from someone else? But that's been what we have traced out in these most recent weeks: clusters, gatherings, and travel, largely domestic travel within our state or to other states. And what do people do when they travel somewhere? Well, generally they're going to very commonly get together with some other people. So the fact that we have seen the number of vaccinated people coming ill, we believe is due to the Delta virus's capacity to infect other people. We feel it is due to the capacity for it to render a previously vaccinated person contagious, even though their risk of becoming infected is still very, very low, unless they're in a very, very risky situation. And that's where using common sense, if you're a vaccinated individual, is very important. You think of using those masks, think of using that distancing if you're in a situation that is of high risk, even though you're vaccinated. So the characteristic of the Delta virus, the phenomenon of gathering and travel, and then to some extent, the fact that we enjoy a much better vaccination rate than many areas of the country.
I'd also like to ask, so since the people who are county employees also enjoy a very high vaccination rate, 70%, do you see any need for, I know that Cornell and IC do not require vaccinations, but they also have a similar process of if you're not vaccinated, you have to get tested. But they're also doing surveillance testing of everybody. Does it make sense that we should do surveillance testing of every employee?
I think that when you get into talking about surveillance testing, there are many, many factors that enter into the decision of how often to test, for example, and who to test. Because you're always balancing the cost of testing, the inconvenience of it, the worry whenever you somebody immediately
You're picking up.
is put in a situation of some degree of stress. Is my test going to come back positive? Am I going to be okay, etc.? So does it make sense to test everybody, the vaccinated as well as the
Dr. Clayback,
when
you're
Cornell did
breaking
its
up a little.
modeling, determining how often to test graduates, they looked at what their status was. Let me check. Is this better?
Yes,
Is this better? Is this
yes.
good? So I was saying when Cornell looked at its decision process to model testing undergraduates, for example, they were taking into consideration the vaccine status of that population, what their crowding would be, and how often testing would yield an impact on the virus. It's a very complicated formula, and they came up with twice a week. This year, in starting out, their modeling is showing a different vaccination prevalence, obviously, because vaccines became available at the beginning of the year, and they're going to continue surveillance for the unvaccinated incoming undergraduates until they can become fully vaccinated, and even then continue some surveillance after that. So I wouldn't say it'd be of a benefit to test all the vaccinated as well as unvaccinated. And really what you're trying to do with the unvaccinated is to protect them from each other who are unvaccinated, as well as help protect your vaccinated, presuming that there will be masks, that are imperfectly used, and an ongoing overarching goal of trying to have an impact on the pandemic.
Okay, last question. We just got a post from Dominic saying about something that's going to go out, and it talks about 87 samples in the months of June, July, were available for sequencing, 86 samples of all variants, 80 of those were the Delta variant. All samples of fully vaccinated individuals sequenced in this batch were issued from the infection of the Delta variant. Do we know how many people that was that the 27% of people were breakthrough infections?
Could you repeat the last part of your question again, please?
I know there was a number of about 27% of the people might have been breakthrough infections. I was wondering whether that's the number that is referred that underlies this 87 samples. Because we talking about like a 1 or 2% in terms of breakthrough infections, but the last chart you sent out had over 50% of them being breakthrough infections, I mean.
So the 87 number are samples that stem from into June through July and into the beginning part of August. The rise of Delta as a predominant and dominant virus variant is a very dynamic situation. If you look at from May, for example, going to the present time, you look at Delta rising from I'm just remembering off the top of my head here, but rising from about a single to very, very low in the teens prevalence to now where the latest figure I heard on a national basis was 90+%. So of those cases that we're talking about, the 87, those are spanning a time during which the Delta was very dynamically rising. And whereas in June and early July, up to about mid-July, it was not unheard of to see a vaccinated person turn out positive. It was not what I would call very common. And then things changed. Things changed on a pretty much in a very fairly quick fashion around mid-July, within the span of about 10 days, to where we started to see cases rising. And of those cases, we began to see the 50% rate of vaccinated compared to unvaccinated begin.
Thank you.
Just a reminder for everyone in the audience, as well as my colleagues, if we could remember to keep our masks above our noses. If for some reason you need to take a mask break, feel free to leave the area, go outside, get some fresh air. If you cannot keep your mask above your nose, then we will have to ask you to leave.
Thank you. You'll wipe the door, man.
We're just going to wait a second. Okay, I have Mike Sigler, Deb, and Annie.
All right, so I'm going to say a bunch of stuff, and Dr. Klepak can correct me if I'm wrong. I won't ask him the questions because I think he's answered everything. First off, why am I wearing a mask? To be honest with you, the only reason I'm wearing a mask is because it's the rule of this legislature right now. I am a firm believer in vaccination. My mother was a public health nurse. I mean, she was a nurse forever. School nurse is how she ended her career. I'm vaccinated for everything. As soon as this came out, the vaccination, as soon as it was open to 50-year-olds, not public officials, as soon as it was open to 50-year-olds, I went and got the vaccination. I cut a video on that, encouraging people to get the vaccine. I think vaccines are a gift to humanity. I always come back to the story about the guy who's sitting on the roof and the floodwaters are rising and a boat comes by and says, "Hey, buddy, get in the boat." "No, God's going to save me." And then a helicopter comes and, "Oh, no, don't worry about it. God said he's going to save me." And he gets up to the pearly gates and he says, "What happened?" And he's like, God's like, "What are you talking about? I sent you a boat. I sent you a helicopter." And I look at vaccines the same way. It's that this is a gift from science. And I always thought it interesting to live in Tompkins, where every year they would put out the numbers of vaccinations for schools. And some of the schools were like 80% vaccination for measles. I mean, measles, for goodness sakes, and that's a deadly disease as well. So for me, I want to go back to something that Dr. Klepak said earlier. If you are vaccinated, it is extremely unlikely that you will get infected. I keep going back to that. I understand that you can get breakthrough, but I don't want people leaving and overestimating the chances of that. I mean, these vaccines are incredibly effective. I understand that, some people, though, I think that what we in the room generally do, though, sometimes, is underestimate people's fear. We act like, well, some people aren't getting this because they're obstinate. I'll address them in a second. But I think some people aren't getting this because they truly are afraid. So I'm going to talk about two different groups. You have the one group that may be saying, listen, this is experimental. I'm hearing a lot of things. I'm not comfortable taking this. For those folks, I would say, listen, I understand that you're thinking that maybe I'm a guinea pig because I went and took this vaccine. I would suggest that instead of me being the guinea pig, you're the Petri dish. You're the dish that this vaccine is being inserted in so that it can grow into something else. So for me, this is a stopgap. The vaccine ends it. So for that group, I would say, don't be the Petri dish. Stop that from going forward. But then there's another group that seems very hesitant to take this vaccine, and these are African Americans in our African American community. And I want to address their concerns. Listen, I get it. This government, not this government in time, but the past governments of the world in the United States did experiments on African Americans. So I understand where you're coming from. I get it. But I want to reach out to you and tell you, listen, as soon as the vaccine came out, I went and got it. I'm not some plugged in politician here. I'm just a regular guy that does this job. But then my wife went and got it as soon as she was eligible. Then my 15-year-old daughter went and got it. I booked my father's vaccine down in Florida. I'm invested in this. So for that group, I would say, listen, if you were looking for people that had skin in the game, that can say, listen, I trust this. That's what I'm telling you. And some people, they're going to be waiting for FDA approval, and that's supposedly going to come soon. We certainly have enough data, I think, at this point for it. With all that said, I have trouble with the mandatory vaccination. I have trouble with vaccinating as a condition of employment. I get the testing idea, but this idea that we are going to mandate somebody put something in their body and ignore their fears or override their fears, I have trouble with that, more trouble than some of my colleagues. So, and I don't really know how to reconcile that yet. So that's all I really had to say. And I do understand other people's anger that this is spreading. But again, if people would just go and get the vaccine, a lot of this problem is solved. So I do encourage everybody to do that, but I don't know if mandatory vaccination is the way to go about that. So thank you.
Thank you, Mike. I also want to thank you because I think over the past 18 months, this has become political war between the Democrats and the Republicans. And whether it's on vaccine, whether it's on Trump or Biden, and it's been so divisive, and it continues to be divisive. And so whether it's crossing party lines or making your statement to support science, like I think that's needed and more conversations needed. And I'm glad to hear that you're coming with that open mind, as well as some of your colleagues I've had conversations with as well. Next is Deb, Annie, and then Martha.
Okay, thanks, Madam Chair. And again, Rich, I'm really sorry to hear that this has hit you so close to home. The young man who came and spoke talked about the many reasons why people haven't been vaccinated. And I'd just like to talk about a couple of categories of people who can't be vaccinated. And one of them in particular, Paul Krugman did an op-ed piece a couple of weeks ago in which he noted that there are over 5 million immunosuppressed adults in our population. I can't remember if it was Frank Kruka or Dr. Klepak who mentioned that that's about 3% of our population here in Tompkins County and across the board. There are also 50 million children under the age of 12 who cannot be vaccinated. And 2 of them are my grandchildren, who I haven't seen in well over a year because I'm afraid to visit them. I'm afraid that if I drive across the country or get on a plane to go to Denver, I'll infect them. They're 3 and they're 6. And if they got COVID and had long-term impacts, I couldn't prove myself. If you follow the COVID-19 pediatric trends, you will learn that nationally, during 1 week in July, the hospitalization rates for children 4 years and younger tripled. COVID-19 cases among children have been on the rise in the US since early July. Almost 94,000 cases among children were added in the past week. The vast majority of child cases don't require hospitalization, but CDC numbers show
that number is increasing. About 200 children with COVID-19 were admitted to US hospitals every day over the past week. Now, our county employees are parents and grandparents. They deal with members of the public who are parents and grandparents, and maybe some children as well. I simply cannot feel any concern about mandating vaccinations that would prevent the spread of this awful virus to children of our employees, to children of our residents. And I guess one of the big reasons that I'm in favor of this is because those children demand our protection. And if you look at the course of this virus over the summer, since March or April, when our county vaccination rates started hitting significant numbers, you will see that if we had continued to get everyone vaccinated, if everyone had been willing to get vaccinated to the extent that they could, we wouldn't be in this position right now. It's imperative that we get as many people vaccinated as possible. And if that means pressuring our remaining reluctant employees, I'm all in favor of it because we owe something to these children. So that's why I'm supporting this resolution. Thank you.
Thank you, Deborah. I have Annie and Martha.
What Deborah said.
Thanks. Annie.
I'll say a little more, but thank you, Deborah, for saying all of that. You put it better than I could have. That's, you know, what I think about when I come to the legislature, when I come to other county buildings, you know, am I bringing something? People, legislators and staff, our county-wide staff outside of this room, which are about 700 members. I try to think about how we can keep them safe, also how we can keep the communities safe at large, and many of our departments are public facing. So I think this is going to help in a lot of different facets. So I kind of look at this, I mean, I know we're following the state's, their recommendation, but I kind of look at this resolution as get tested to employees, get tested, or you can opt out by being vaccinated. I'm not going to entertain changing the wording. I think people get that you don't have to get tested if you're vaccinated. And as Deborah said, some people are immunocompromised, or if there's other reasons they don't, they're not going to get vaccinated, and they get tested. There could come a point where we're testing all employees if the vaccine, or if the Delta variant gets worse. It could be that we're having to shuttle and have as many people work at home again. It could be businesses are shut down. It could be schools are shut down again. So we're trying to prevent that. So this little bit that we're doing here, I'm fully in support of. And on that note, I was wondering if, maybe this has been said before, but as far as our county departments, if we've heard back from our department heads, how they feel this might affect them, if we've heard positive or negatives.
We have a department head meeting tomorrow where we'll be hearing more, but overall, we have not been hearing.
Okay, thank you. Please keep us informed. Thank you.
If I can interrupt, I got a message from my husband, who's one of our biggest fans, who said that with our masks on, we need to talk closer to our microphones and louder. So please bear that in mind.
Thanks, Ronnie.
Thank you, Ron.
Martha?
Okay. Hi, Ronnie. I won't repeat things that are, but I agree with a lot of what everybody has said. Thank you, Mike. I love the helicopter story. I've heard that before. I would say though, that we're not saying at this point that somebody can't work here if they're not vaccinated. We're saying, we want you vaccinated, but if you're not, then just get tested. So one point about the experimental nature, I mean, the mRNA process has been researched on science, and testing has been done for more than 10 years. It's been underway. It's not something that somebody just pulled out of a, out of a blue sky thing. That this has been in the works, and science was prepared for this to move forward. And we're just very lucky that we have this gift, as it's been said. I have a question for Dr. Claycock. Okay, it's the box is still there. The question of why the delay in the FDA approval for permanent authorization. And I've heard, oh, you got your office. I've heard that it's things like, it's not about the efficacy or safety of the vaccine, but things like they have to authorize manufacturing processes and make sure there's a supply chain available to produce it, that kind of thing. Can you further explain what goes into this final step?
Yeah, I can to the best of my knowledge. So you are correct that as you move beyond the emergency use authorization, the dynamics of using a vaccine change. So when the pandemic, if you go back to last January, last December, when Pfizer got its emergency use authorization, all those doses that had been produced were immediately going to be shipped out and used. And any new doses produced in the pipeline were immediately going to get shipped out and used wherever they were able to be used. So there is no storage issue. The distribution network is largely through the federal government, state governments. So the dynamics are quite different compared to when you go into a situation where, say, for example, with measles vaccine that was mentioned earlier, that vaccine is used, but it's used on an ongoing basis. Supplies need to be stored for a considerable period of time. The distribution network is through conventional commercial outlets, then going into physicians' offices or clinics or the VA or whatever venue is dispensing them. So all of those steps and the storage conditions and the capacity to store and the quality assurance along the way that things are as they should be is a different dynamic and requires certification and documentation and inspecting by the FDA. The other thing that goes into the full approval process is considering all of the data that has been accumulated since the vaccines first began to be used in the general public. So going and looking at the actual real world experience of how did the vaccines perform, how many people did it protect totally, how many breakthrough infections occurred, how many people had side effects, what were they, were any of them, what about, we've all heard of the Guillain-Barré issue, we've heard of the blood clotting disorder with some of the vaccines, looking at all that data, side effects, hospitalizations, and what that amounts to, I'm told, is hundreds of thousands of pages of documentation that need to be reviewed. And of course, that requires some time. And then in addition, the inspections that go along with that. So within our country, we have about 5 different systems that are continually monitoring these COVID vaccines that we have in use. The one that a lot of physicians and health agencies are familiar with is the Vaccine Adverse Events Reporting System, or VAERS, which in fact any individual also can report into. anybody who thinks they had any kind of a reaction to a vaccine, any healthcare person taking care of them who thinks this might be remotely related to a vaccine can submit a report into the system. And that report is looked at, evaluated, trends are looked for, etc. But that's not the only system. There are about 4 other systems that are in operation looking at this. That type of information also plays a role in the FDA considering full licensure. So it's a lot of different data collected over a long period of time. And I have to say that the VERS system, the VIS system, the various other systems that have been used, all of them have served their purpose, I think, very well. The clotting disorder was identified as, is this something that's rising to be something that would change our mind about the vaccine? The Guillain-Barré similarly, et cetera. And when you come down to the end of the day, yeah, those things do exist, but they're extremely rare in the vaccine usage. And when you look at any side effects that people have, including any of the more severe ones, the risk of COVID, the risk of the infection itself, is a far greater risk than the risk of the vaccine. And so therefore, as we go forward, that's what has continued to give confidence that these vaccines are just as we thought they were, and we have not seen any red flags go up that say, whoops, we got to radically change direction.
Thank you very much. So in my mind, if this resolution mandating vaccination by county employees begins October 1st, there should be time for even the most cautious, most skeptical person to see that probably Pfizer, maybe Moderna as well, would already have completed that laborious, rigorous process, and that it's the right thing and the safe thing and the healthy thing to do. Thank you so very much.
I would add one
Okay, I have Mike Lane. We are going to have to wrap up in about 15 minutes because Kathy has to turn off the system and start it up again for our next. So I just want to give everyone a heads up. I have Mike Lane. Oh, well, that's easy enough. Any other, Glenn is second? Second. Okay. And all those in favor? I think we're ready. Okay. Oh, sorry, Henry. Okay, we have one abstention? Or, sorry, one no. Thank you. Sorry. Okay, we have resolution 10296 on the floor. Again, that is implementing New York State Governor's recommendation that all county employees be vaccinated against COVID-19 or get tested weekly. All those in favor? I have 9 votes for yes, and those against? I have 2. That passes 9-2. Thank you all. If I could have a mover, Martha?
Yeah, when we spoke at Budget Capital Personnel yesterday, we talked about having an executive session at the end of this meeting.
I thought we had said the 17th. Is that what others had
I
understood?
thought it was the end of today.
I thought it was the EDC meeting.
Now, this is the meeting of the legislature, at which it's a legislature issue. I thought that's why we talked about Ruby being here for the end of that.
I thought we said the 17th. We had agreed upon the 17th.
Well, it was clear we had agreed to a legislative meeting and
Yeah.
not an EDC meeting.
Right.
I had understood it was the 17th.
Yeah, I think the conversation would best, we would have the most information if Leslie were here, since she was not part of our conversation yesterday.
I just want to.
Yeah, go ahead, Mike.
I did request to be at this meeting.
Get to your microphone.
Martha did request it to be at this meeting, whatever you folks have decided, I don't know, but that was her request.
But Martha actually came back and said, yeah, it would make sense for it to be at the 17th
No,
meeting.
for this meeting, somebody was talking yesterday about putting it at the EBC meeting. I said, no, we have a legislature. I know it's the same 14 people, but this 4 o'clock meeting is a legislature meeting rather than an EBC meeting. That's what I meant.
Well, I meant Leslie's not here, and that is the one person that I think was important to have as part of this conversation.
As well, I think that we would be rushed.
Yeah.
I mean,
And if we were going to have an executive session, quite honestly, I should have said it at the beginning of the meeting.
Well, I was in the restroom at the minute. I thought you might have said it when the meeting was gaveled, so.
Rich?
Yeah, I think I might have caused some of this confusion at budget committee yesterday. I was thinking this is a budget, capital, and personnel issue. And EBC is the expanded full term as budget, capital, and personnel committee. But I do agree it would make sense to have Leslie here.
Okay. So we will have that conversation next Tuesday at the legislature meeting. If I could have a mover to adjourn, please. Moved by Annie, seconded by Glenn. All those in favor? Okay, we will see you at 5:54 EDC. Thank you.
Bye.